Hello everyone. My name is Ayesha Chaudhary and I am delighted to share my thoughts at the WomenLift Health Forum. I am an innovator by profession. I consult with selected impact driven organizations, but that is only 25% of who I am. The remaining 75% likes to practice a yogic life, spend time with family, and in community building. While I was growing up, I was a bookworm, didn't engage much in co curricular activity and social relationships. It is only in the last 10 years that I have integrated different facets of life into my existence. And now I feel healthier, happier, and empowered. I started my entrepreneurial journey about 10 years ago, before startups actually became a fashionable household term. Back then, I had to overcome a mix of internal and external barriers to become an entrepreneur. But today, I have evolved into an individual who is driven by impact. There were several tipping points in my life, and therefore, the question that I chose to address through my leadership journey is how can we empower more women to experience such moments and maintain a healthier self to grow both professionally and personally? Over the last few months, I have attempted to understand the correlation between good health and effective leadership for women. The assumption that I took is that if you're healthy, you can be an effective leader. But what is good health? It is not limited to only physical health, it is much more. It includes physical activity along with mental and emotional well being, social relationships, and having a meaningful life. As I started to interview women leaders in India and globally, I realized that people define good health in different ways. For some, it's about being physically fit and engaging in outdoor activities that allows them to be a leader. For others, it is being at peace with themselves in whatever they do and maintaining their emotional well being. Some women get their energy from deep social relationships. Others look for a meaning in life for being healthy, and this allows them to be an impactful leader. So, it is usually a combination of one or more of these components of good health that really drive women leaders and empower them to lead. In fact, one of the leaders also mentioned that if I don't feel healthy, happy, and good about myself, I cannot behave as an authentic and impactful leader. And therefore, it is important for each one of us to identify what is good health for us. But what continues to really trouble me is this concept and definition of leadership. It's often limited to individuals who are leading large organizations as heads and CEOs. But what about self leadership, family leadership, community leadership? As I got introduced to the four pillars of leadership journey, I realized that leadership is much more than the formal authority that your profession may provide you. Leadership is about exploring your meaningful life, one that makes you happy. It is about knowing yourself and inspiring people at work, in the family, and in the community. So, we need to add a new dimension to the concept of leadership and make it gender inclusive because women leadership, especially in India, may not always have a formal authority. This is a complex area that needs more research, wider consultation, and systematic documentation. So I will continue to work on this with two organizations that have similar interests. One is Sports and Society Accelerator, which is interested to understand the role of physical activity and sport for women empowerment and leadership. And the second is Women Entrepreneurship Platform, an initiative of the government where we will be leveraging research, innovation, and policy to empower women entrepreneurs to emerge as effective leaders. So the journey has just begun and there is lots to be done. I'd really like to thank Ritu Kamal a former US Cohort fellow who nominated me for this journey, and a big thanks to the Women Lift Health team and our cohort. Hope to continue to create collective impact with all of you. Thank you. Thank you very much.